Good afternoon. I am Dr. Saurabh Garg, Assistant Professor in the Department of Plastic Surgery at Mahatma Gandhi University of Medical Science, Jaipur. Today we will discuss about the classification of the flap. So before going further, we need to know what is flap. So it is a unit of tissue which is transferred from one side, that is the donor side, to the recipient side with its own blood supply. So the flap can be classified in different types. So there are six types on which we can classify the flap. The first is the composition of the tissue. The second is circulation. Third, which is the congruity of the flap. Fourth is configuration. Fifth is construction, and last is conditioning. So we will discuss about each classification in detail in the coming slides. So first is composition. So on the basis of the type of tissue we are transferring, the flap can be classified as a single component or the multiple component. In the single component, the flap consists of single type of tissue. So it includes the skin flap, for example the cross finger flap, the muscle flap, for example LD flap, the bone flap, the flap containing only the fascia, which is as a temporoparietal fascia flap, and the visceral flap. The example for the visceral flap is the omentum flap. Now coming to the multiple component, which include the fasciocutaneous flap, myocutaneous, or osteoseptocutaneous. In the multiple component, there are more than one component is included. So in the fasciocutaneous, we take the skin, subcutaneous tissue, and the fascia. And this fasciocutaneous flap are classified on the basis of Combach and Lamberti classification. So there are four types of fasciocutaneous flap. In type A, there is a multiple independent perforator. You can see this is the type A. The example for type A is the upper arm flap. The second is type B, which contains single perforator flap coming from the axial vessel. The example for this are supraclavicular flap, scapular flap. The type C flap has the multiple perforator, and all the perforator are coming from a single axial vessel. The example are the radial artery forearm flap. And type D is the extension of type C, in which bone is taken along with the flap. The example are fibula flap, radial artery forearm flap with the bone. Now the second multiple component flap is the myocutaneous flap, and these myocutaneous flaps can be further classified into 5 types. And this classification was given by Matthews and Nahi. In the type 1, we have a single dominant pedicle. The example for this is tensor fascial lata flap. In type 2, there are one dominant pedicle, and there are minor pedicle along with the dominant pedicle. And the example for this is the gracilis. In the type 3, there are two dominant pedicle. The example is gluteus maximus flap. In type 4, there are multiple segmental perforators. And the type 5, there is one dominant and other are the segmentals. Now coming to the second type of classification, which is based on the circulation of the flap. And on the circulation, flap can be classified into random pattern and the axial pattern. In the random pattern, there is no specific or named vessel, and their blood supply derived from the subdermal and the dermal plexus. Whereas the axial pattern flap, they are based on the specific vessel and which run along the axis of the flap. They can be further classified into peninsular flap. In the peninsular flap, the blood vessel and the skin both are attached at the base of the flap. The second is the islanded flap, in which the skin is divided at the base, whereas the vessel is connected. And third is the free flap, where both skin and the vessel are divided at the base. And third type of classification is based on the congruity, that is the proximity to the primary defect. So on this, flap can be classified as local, regional, and distant. So the local flap, as the name suggests, the flap is taken from the side immediately adjacent to the defect, and it can move into the defect by advancement, rotation, or transposition. The regional flap, the flap is taken from the same region, and blood supply remain connected to the donor site, and their movement can be described as transposition or interpolation. So these are the few regional flap. For the At a neck reconstruction, we use pectoralis major flap, delta pectoral flap. For the face, TP fascia flap, and for the hand, we are using the reverse radial PIA flap. These are the regional flap. And third is the distance flap. When the flap is taken from a different part of the body, and these distance flap can be pedicle flap or the free flap. Fourth, classification on the basis of configuration. On this movement, on the configuration, we can classify flap into advancement flap, pivotal flap, and the interpolation. And we will discuss about this in the next class. The fifth classification is according to the flow, and on the flow we can classify flap as the antegrade flow and the retrograde flow, and it can be also classified as unipedicle and bipedicle, and the retrograde and orthograde flow. And the last type of classification is the conditioning of the flap. On the basis of conditioning, we can classify flap as delay, prefabrication, and the pre-lamination. And so this is a brief about the classification of the flap. In the next class, we will discuss about the geometry of the flap, flap movements, and the conditioning pattern, prefabrication and lamination. Thank you.